The vice president has COVID, and cases here in Wisconsin continue to climb. Lots of COVID news today, and that's because it's a Tuesday when we talk to Dr. Jeff Potoff from UW Health. He is the Chief Quality Officer. Doctor, great to see you. So we've learned Vice President Kamala Harris has COVID, but no symptoms. And to me, the takeaway is just how contagious this new subvariant of Omicron is. I mean, she's in a bubble. You have to be vaccinated to be in the same room as her and boosted and oftentimes wear a mask. But even she got it. And that's why we're seeing a spike in cases even here in Wisconsin, right? We're over 1,000 cases per day for the first time in a while.
Yeah, it is really difficult to really overstate how contagious, these variants are becoming. Delta was really contagious. Then there was the original Omicron, even more contagious. And now BA2, which is even more contagious than original Omicron. So, if you're out there in public, there's a good chance you're going to come in contact with this. I think the other takeaway from the Kamala Harris is really that she's vaccinated, double boosted, and she's likely to do pretty well with this infection. So even though we can't prevent symptoms from happening at all, our vaccines are really protective against severe disease.
Hey, if it seems like everyone's gotten COVID, especially recently, the CDC says you're right. Nearly 60% of Americans, they say, have come down with it at least once. In kids, it's more like 3 out of 4 got it. But looking at the bright side of that news, is that why we haven't had to go in the lockdowns again like other parts of the world? I mean, the virus, is it starting to have trouble finding a home?
Well, that is the theory that we're working on, not to belittle, the tremendous number of people who got sick and those who died during the Omicron surge just because so many people came down with it. But it is likely that between folks who are vaccinated and boosted and those who have come in contact with the virus recently, that although they're not protected against having symptoms or seeing those cases rise, they may be protected against severe disease. And we may continue to see that hospitalization rate stay low, which is really the ultimate metric of, are we handling this pandemic, this virus in the right way or not right now?
And let's talk about people who are in the hospital, because there's been so much focus on trying to not get the virus, right? But there is a lot of good news that's coming out if you do come down with it. Let's talk about this pill. We've often said, I wish there was a magic pill for COVID. And now it seems there is something on the market that's making a big difference. And there's been big news today with a drug called Paxlovid. What is Paxlovid?
Yeah, Paxlovid is a medication that if you take it and you have some risk factors, there's reason to think that you could do a little bit poorly from COVID-19 infection. You take it within 5 days of symptom onset, it significantly reduces the chance that your case becomes a severe case. And I think with all of the news around COVID-19, this one has kind of been forgotten. We know that there's a lot of people who would be eligible for Paxlovid who aren't necessarily seeking it out or getting it. So this increased availability is helpful. I think certainly something to talk to your doctor about. There are some drug-drug interactions with Paxlovid that you want to be mindful of. But if you have COVID and you're worried that you could get really sick, go out and see if Paxlovid's a medication that's right for you. There's a good chance it is.
And that's the news today. It was a drug that was almost impossible to find, but the Biden administration's opening it up, right? It should be easier to find now.
Like with most things during the pandemic, initially supplies were low. There was allocations. You really had to be in a specific group of people to be eligible for it. Now, as supply increases, folks should be able to find this fairly easily in their communities if they come down with a positive COVID test.
Paxlovid, write that one down. Dr. Jeff Potoff, thank you so much for all that information on a very busy day.
Thank you.